Now within 1 year of marriage, of 1.5 year of marriage, either the girl is studying or the girl is working or she's shifted, she's just married, she doesn't know the family. If she doesn't conceive, that is taken as a stigma. So then that is the time the finger pointing starts. Half of them say that the husband is responsible. Without trying, without taking any treatment, they are so stressed and they are so anxious that they run to all possible corners to seek treatment without even knowing or trying to find out what the problem is and where the problem is.
Welcome back once again to my show, Noble by Richa. It's a corporate podcast. Another episode with our guest, Mr. Neelkanth Belvi. He is a renowned gynecologist and infertility specialist in Pune. And today, our episode is based on all the corporate people, especially the women who are struggling out there with their fertility issues and a lot of issues which are unsaid and unspoken. So, here is our guest, Mr. Neelkanth. Welcome
Hello.
to the show.
Thank you.
How is the experience so far here on the show?
Good. This being my first podcast, it's a pride and a pleasure to be a part of this important meeting.
So we would love to know about you, Mr. Belvi. How is your experience so far in Pune and about your personal life as well?
So I have been practicing obstetrics and gynecology in Pune since the past about 19 years, with special focus on ultrasonography
Mhm.
and infertility also. Overall experience has been quite good. So far, so good.
So with all like which all hospitals you are working with, or do you have any certain clinic of
I
yours
have two
nearby?
clinics, one at Vanavdi and one at Hadapsar. Both the clinics are specialty gynecology clinics with
Okay.
specialty with facilities of ultrasonography in pregnancy and infertility. And I'm
Okay.
attached to major corporate hospitals where I operate and admit my patients.
So anything you want to tell us about your personal life as well? Like how was your college? How was your journey from college being a doctor? What all
It was a very
challenges?
tough journey, but an enjoyable journey.
Okay.
And my wife is also a gynecologist.
Oh, that's great to know.
Yeah, I have two children who are in school, and we are both practicing in Pune itself. She's attached to two hospitals. We both run two clinics.
So I think I have heard about your clinic, the Nandini clinic, which is
Yes,
out there in
yes,
Vanuvadi in
yes,
Pune.
yes.
Okay, that's great to know. So coming to our questions, since it's a corporate podcast, so I want you to, give your point of view for the corporate ladies and the parents out there who are struggling with the fertility and they are actually, planning their family life quite late due to stress life of corporate.
This is a major issue which is seen nowadays, especially in the corporate world. Any couple who comes from a corporate world and they are married, the first thing on their mind is not to have a pregnancy rather than have a pregnancy. The so-called corporate world is just so demanding that beyond your work there is nothing. So naturally pregnancy and fertility takes a back seat. Many of these couples are new to Pune. They are not from Pune, who have come to Pune for some job or from workplace, or they've been posted here. So they have been settling here. There are only two of them. And when any young couple comes who is pregnant, and when I ask them that whether you want to continue the pregnancy, the first thing they say is no.
Okay.
And then when I ask them the reason, the first thing they say is, we have just shifted to Pune. We are only two of us. There's no support. We are from some other place. It's a new job. It's a new placement. We are yet getting adjusted. So we are planning a year later or 2 years later. And then slowly the husband says, is bar to galti ho gayi. But
Okay.
then we'll be more careful in the near
Okay.
future. In short, the delay is with the pregnancy, where work takes a priority. Naturally, pregnancy is second hand.
So, like, what do you suggest for the women, if they want to plan the fertility and they are working and, managing the work and the like personal front as well?
What I tell them is that pregnancy and work should go hand in hand. Now, of course, it is easy for me to say. When they are pregnant, the first thing that comes to their mind is they don't want to continue the pregnancy. If they are planning a pregnancy, they take steps to see to it that they don't land up with a pregnancy.
Okay.
If they don't land up with a pregnancy, then they are very happy. But then, if they are pregnant, then the issue of a termination arises. Many of them are unaware of their periods. Many of them don't know their body, that is the date of their period, because the most important thing is the date of the period and the regularity of the period, which depends on so many factors.
Okay.
Now, this regularity of the period and date of the period is very important in planning fertility. So if you don't want a pregnancy, so it is more of fertility care rather than infertility care. They
Okay.
have to know the exact date of the period and plan it accordingly, so that during that time the fertility index is high, so chances of getting pregnant are very high. So those, they have to avoid those dates in an attempt कि pregnancy ना रह जाए.
So, any lifestyle changes would you suggest, or do you think, and have you noticed that there is a drastic lifestyle changes, which is causing this much of abortions or the miscarriages or the late pregnancy?
Oh yes, in this corporate world, definitely. All these pregnancies which land up with abortion, any couple who comes for an abortion, 90% of them are unplanned pregnancies according to them. Abortions, 90% of the time, they are self-induced, or that they have taken the decision. So there is a drastic change in what was happening before and what was happening now, mainly due to the corporate lifestyle.
Okay.
Previously, the dictum was get married, have at least one child, तो दूसरा बच्चा तो आ जाएगा.
Mhm.
Now, the owner says delay the first pregnancy as late as possible, because previously it was that 30 was the cutoff. Beyond 30, childbearing and pregnancy would become a little difficult.
Mhm.
So that 30 ka age number has shifted to 35. So couples between 30 and 35 are very happy. They say we have 5 more years to go. Second thing is the demanding nature, or the time, or the stress of the corporate life, which forces them not to have a pregnancy. They say that we are so forced, we are so taxed, we are so stressed out that we cannot plan a pregnancy. Of course, finance, home, parents are not here, there's no domestic help, there are so many other factors which play a role.
Yeah.
All in all, they don't want a pregnancy, if at all there is a pregnancy. And many of them say, you tell us something whether we can delay the pregnancy by about a year or two.
Okay, so it's a very mixed up.
It's a very mixed up thing. Those who don't want, they are very specific that they don't want for a certain period of time. They know the pros and cons of it. It is only 10% of people, the couples who say, suppose a late age or a late marriage, who say that no, in spite of all the odds and all the difficulties, we want to continue. We have support. Parents say, ye hai, wo hai. 90% of them say, no, we don't want, we'll see a year later or two later. So it's a mixed sort of a reaction.
Okay.
But then the delay in pregnancy is the bottom line.
But don't you think that surviving in the metro cities, especially like Pune, Bombay, Bangalore, where everything is quite costly, out of couple, both husband and wife, they are working. So don't you think it's a necessity that both the people go to work, and of course it will cause delay and the stress in your personal life, and it will cause delayed conceive.
Yes, that is why they don't want to conceive, because both of them are working. Now the concept of work from home has come.
Yes.
Previously, one is working in Hinjawadi, the other one is working in Viman Nagar. The couple stays at Magarpatta. The first question they ask is, "बच्चे को देखेगा कौन?"
Yeah.
In-laws either side, they are not willing to come, because majority of them are from some remote place. They come for 15 days, which hardly makes a difference. So the first question which comes to mind is, अगर parent pregnancy रही तो बच्चे को संभालेगा कौन, because we are working. The second question is of course the financial issue, and the third is of course the accessory, the other parts, that घर नहीं है, job certainty nahi hai, especially in the IT sector.
Yeah.
Or then couples say that we are working here, but then 6 months down the line, I'm planning to relocate. He's going to Germany, I'm going to Italy, or we have got an offer from from abroad. So we don't want to do anything half-heartedly. It's better that we go there and plan.
Okay.
अगर वो कैंसिल हो जाए तो हम बाद में देखेंगे.
Or do you think so? Is it more of giving birth to your child out of the country? Because I have seen this pattern as well in parents.
They
these
do,
days.
especially the couples, especially the corporate and IT sector, those who go to UK as compared to USA. They see to it that the planning is such that the child is born there.
Any reason for that?
Citizenship,
Okay.
life may be easier, or whatever. But
Or the healthcare is not that great in India. Do you
no,
think so?
healthcare in India is much greater. Not great. I would not say greater, but it is much better than what it is there.
Okay.
The accessibility, the availability is there, the accountability is there in all sectors of healthcare, whether it is just taking a tablet for a headache or undergoing some major surgery. Healthcare system in India is much, I would say, I won't say advanced, but then easily accessible to everybody.
So, what is the change which you have noticed when, like, in your time zone and with the current generation which is here? So, what is the difference you have seen when it comes to having a baby or starting your family? Like back then, people used to get married early and used to have kids. So, what is the change you have
Well, in
noticed?
corporate life, everything has shifted. The age of marriage is increased, not only in corporate life, in every other, like in medical life also. So, late marriages, late pregnancies, previously early marriages, and at least one child was the norm. early child, then the second pregnancy would follow.
Yeah.
And it was a joint family, so the parents or the in-laws would be there, so there is somebody to take care of the child where both the parents are out.
Yeah.
But now, first of all, is the late marriages, migrating to some other city or out of India also. And the third thing is nobody to take care of the child. So all this plays a role in delaying the pregnancy. And there are some percentage of couples who will say that we don't want a pregnancy at all for whatever reason. It may be their personal reason, it may be one of this reason, compatibility may be one issue. But then there are so many couples whom I have come across who say that we know for some reason we don't want a pregnancy, and accidentally if there is a pregnancy they see to it that they get it terminated. They under no circumstances do they want to continue.
Okay.
But then this is the change which I have observed. Early marriages and early pregnancies, the owners has shifted, and one child norm is been the norm now. They say
Okay.
only one, previously it was two. So then they say एक भी बच्चा अगर हो जाए तो ठीक है, and then
Nowadays it's coming to zero
it
as well.
comes to zero. That is what is
has
called as
come.
dinks. That is double
Yes,
income, no
no
kids.
kids.
There are
Yes,
so
I
many
have heard
there are so
about
many couples who say that we don't want pregnancy. Like a month back, I had a couple. The husband was 41, the wife was 34. They were married since 10 years, and they landed up with a pregnancy, which was an unplanned pregnancy. But then they were very categorical. They said that under no circumstances do we want to continue this pregnancy. Age is one. He's going in 6 months. He's in the merchant navy. I have my own job and my own life. So I don't want the kid to be stranded between two of us. So the simpler option and a safer option and a more practical option would be not to land up with the pregnancy.
And there is a situation where I have heard that a lot of girls and women out there, they actually don't know the cycle, how to count the cycle days and the different ways of conceiving, which is IUI, IVF, and
Yeah.
also. Would you like to show some light
See,
on it?
for a pregnancy, the most important thing is the cycle or the period which we go. The number of days a lady bleeds, how much she bleeds, and how regular are the cycles. Regular is in the sense she bleeds. A regular cycle is a lady should bleed for at least 4 to 5 days a month, maybe a little here and there. That is called as regularity of the cycle. Now, the concept of regularity of the cycle and bleeding varies from person to person. A person who is staying in a very low socioeconomic doesn't know. All that she knows is पाळी यायची आणि मुलं झाली. That is what she knows. But then now with nowadays all these apps and all, they track it
Yeah.
at the drop of a hat, and they know how regular are your periods. So the first thing is they should know about the periods. They should know how regular your periods are, because that is the most important thing. The cycle lasts for about 4 or 5 days. Now, in any cycle, we consider a number 28, because we consider, although a month is of 30 days, we say it is a 28-day cycle, which means it is a monthly cycle. And periods are regular. It means that she gets her period every month. When she gets a period every month, the bleeding should stop by the about fourth or the fifth day. The fertile period or the fertile index, which is there, that is from the day 11th to the day 18th of the period. Suppose she gets her period on the 1st of July. The 11th day is the 11th of July, and the 18th day is the 18th of July.
Okay.
Now, another misconception is 11th day, they think that it is from the time the period stopped. So, if the period stopped on the 5th of July, they consider the 11th day to be the 16th of July. From the first day, the 11th day to the 18th day, that is the fertile window.
Yeah, there's a misconception about
There is
dates
a great misconception about dates. Half of them don't remember. They correlate with some function or with some festival or with some holiday or with some major event which occurred in the family, either somebody's birth naming ceremony or somebody dies. Half of them ask their husbands, and the husband starts shouting on her, "Tula mahiti pahiye," and then they fight, and they arbitrarily, because I'm looking at them very expectantly, they give me some date. अभी तो ये पूछेगा नहीं.
Yeah, okay.
So there is a lot of I would not say misconception. There's no awareness about the date, simply because of the fact that even if they bleed for 2 days in the month, they'll say the periods are regular.
Okay.
Even if they bleed 10 days a month, they'll say that the periods are regular. They don't take into account the amount of bleeding and the number of days. So which is very important with regards pregnancy.
So do you think so that there is a still taboo, people are not talking openly about it, and that's why the awareness is not there?
Yes, there is a
Even
lot.
after being educated.
Yes, there is a taboo. There are only 25% of patients who are very well versed with their period. They say that no, I'm very sure about my dates. Dates एक दिन भी यहाँ वहाँ नहीं होती. The 60% of them say that no, they give some arbitrary date. The remaining 15% are totally unaware. They don't know. As I said, they correlate with something. So the number of the percentage of patients who are really aware of the date is only 25, which is quite a small number, which
Okay.
shows the dropping this incidence of the menses and unawareness of the cycle impacts.
Okay. And what do you think why there is a rise of a lot of IUI, surrogacy, and especially the IVF? Like there's a big hoardings all over, about the fertility, IVF, and all these things. So why there's an increase
See, as I said,
suddenly?
now the onus has shifted from fertility care rather than infertility care.
Yeah.
With time, with the lifestyle, so for some reason a lady doesn't conceive, then there's a taboo, as I say. Now, because previously early marriages and immediately within 1 year the girl would become pregnant, so everybody in the family is happy. Now within 1 year of marriage, of 1.5 year of marriage, either the girl is studying or the girl is working or she's shifted, she's just married, she doesn't know the family. If she doesn't conceive, that is taken as a stigma. So then that is the time the finger pointing starts.
Yeah.
Half of them say that the husband is responsible. Without trying, without taking any treatment, they are so stressed and they are so anxious that they run to all possible corners to seek treatment without even knowing or trying to find out what the problem is and where the problem is.
Yeah.
It is always finger pointing across each other. He says that हिच्यामध्ये problem है, she says ह्याच्यामध्ये problem है. There may not be a problem because childbirth has been going on since generations now. So it is a natural thing. There are problems, no doubt, sometimes subtle problems which are there, but then those problems sometimes are not very major. उसको issue बहुत बनाया जाता है.
Okay.
कि नहीं हो रहा है ना, go for IVF. And more than the couple themselves, आजू बाजू वाले लोग, either it is friends or in-laws or and the most important question that they ask is, my friend conceived within 1 year. I have been married since 2.5 years. She's 4 years.
So there's a comparison.
She's
and the
4 months
stress.
younger than me.
Okay.
Why am I not conceiving?
So there's a lot of comparison.
There's a lot of
and
comparison,
stress.
there's a lot of stress, and there's a lot of anxiety as regards not conceiving. If they conceive, they're very happy, but if they don't conceive, they are prepared to just do anything to have a child, including selling of their land or property or whatever. IUI and IVF, I won't go into the details of IUI and IVF because I don't do IUI and IVF.
Okay.
But then it has become a second option. Nahi ho raha hai to IUI karo. Now the general norm is, when we say that the couple is infertile is a stigma when they don't conceive. It is when they don't have a child for 6 months after trying on a regular basis. Husband is in the merchant navy, he comes once in a year for 10 days. Wife is here, वो 10 दिन आता है चला जाता है, शादी को 5 साल हो गए and बच्चा नहीं हो रहा है. That is not infertility because the couple has not been staying together. If consistently after staying together and trying for a period of 6 months without any treatment, if the couple doesn't conceive, then she has to go for treatment. But unfortunately, couples are not willing to wait nowadays for that
So
long.
that calmness and resilience is not
Is
there.
not there. The patience is not there, solely because of the fact कि आजू बाजू में से बहुत प्रेशर आता है. You know the in-laws है कि नहीं इधर, and they just go hopping from one place to the other. यहाँ रिजल्ट नहीं आया तो वहाँ जाओ, वहाँ रिजल्ट नहीं आया तो वहाँ जाओ. इसमें होता क्या है, they end up spending a lot of money, time is gone, there's no result, and then they come to a standstill because they've tried everything under the earth. Okay. Nothing seems to work. So then IVF and IUI become the obviously available options.
So ending this question and on a note, and I want to know that from your end, what is the one feedback you want to give to our listeners if they really want to have a stable life, out of this sedentary lifestyle? What they should eat and follow?
See, it is basically
basic
taking
routine.
care of yourself and taking care of your health. You may work in a corporate area, you may be a pilot, you may be a homemaker, you may anybody. Ultimately, your health counts and you only are responsible for your health. Have a healthy lifestyle. And the most important thing is stress related बहुत है. Especially in the corporate sector where the working hours or the working environment, it is too demanding that they don't think of anything else. By the time they come back, they're so exhausted. So take care of your health, have a balanced diet, lead a stress-free lifestyle, which is not possibly easier for me to sit here and say that lead a very healthy lifestyle, and concentrate on yourself, because inborn diseases जो है अभी, they are coming out of this very stress. Stress is one thing which leads to all the majority of the diseases under the sun, under the earth. Heart problems, blood pressure, diabetes, ये जो killers है, these are mainly because of a sedentary lifestyle. So contrary to the popular belief कि a 60-year-old man only dies of a heart attack today, young boys of 20 and 25
Under
are
30s
landing
also
up
they
with heart
are
problems
falling prone to all
and
these things.
काम का pressure, the company is all the time sitting on your head.
Yeah.
Performance, performance, performance. Smoking, drinking, long working hours, no sleep, junk food, all no exercise, all this adds up. And then one fine day, suddenly when the blood sugar is about 200, they get a jhatka.
Yeah.
And that is the time when they backtrack कि ये सब हो रहा है. And that is the time when it starts slipping.
So any additional food or any lifestyle they need to add
See,
on?
6 to 8 hours of sleep is this thing. Refrain from alcohol or anything. It is easy to say, but then you have to have time for yourself in the whole day.
Mhm.
30 to 40 minutes of exercise in any form. You may do yoga, you may do an aerobic exercise, you may run, jump, hop, jog, whatever you do. But then 30 minutes of exercise with a balanced diet. And of course, wo stress related jo kaam ka hai, that cannot be taken away. That is going to be there. And unfortunately, it is going to increase day by day. But then you have to keep yourself fit. You can't neglect your health and go there, because one fine day you will fall ill. And foods, of course, see, with these junk foods and all coming up into the show. So junk food is one of the killer, but then unfortunately there's no choice for many of them. You know who जिसका घर है वो डब्बा वगैरह लाएगा. So many people say that नहीं हम लोग बाहर खाते हैं, खुद बनाते हैं.
And there is a lot of canned food also these days.
Canned food,
And
canned
some-
food and preservatives and junk food. These are the killers because they contain a lot of preservatives, which is high in sodium. Then it leads to sugar and BP problems, weight problems, and then to counter the weight nowadays, the new fad about injections has come where you lose weight.
Yeah.
So everything leads to the other. One wrong step leads to the.
So it's great to hear all these details from your end based on your experience. So I want to know that what suggestion comes from your end for the corporate so that they arrange such a podcast or such alumni talk or a session where they are making aware their employees, especially the female employees, about these all challenges which is happening about the pregnancy, fertility, or the sedentary lifestyle. Do you think the corporate is lacking behind making aware about them? It's only about work.
Yes, it is not only about work. They are certainly lacking in, I would say, overall healthcare promotion. It's not only for the female employees, for the male employees also.
Yes.
There are some companies who arrange healthcare programs or health checkups on a regular basis. That should be done. Number one, for the female employees, of course, there's a lot of there are a lot of information which is to be provided for the female employees as regards the period, especially the young girls who are unmarried. Yes. Or who are just married, who are planning a pregnancy, because it forms the bulk of the IT sector. So they need to have sessions or workshops or lectures or seminars where these female employees open up in front of somebody in regards to their periods or somebody. Many of these girls have irregular periods or delayed periods or something which has been with them since a long time, but then they are scared, they're very apprehensive to open up कि हम किसको बोले और कहाँ बोले.
Yeah, right.
And especially if there is a corporate setup where there are a lot of males around, it is further embarrassing for the girl to talk about these
But
problems.
I don't think so. Like in this 21st century, this topic should be embarrassing one.
It is
It's
not.
still treated as a taboo.
Yes, it is still treated as a taboo. It is still, especially the girls who come from a low socio, I won't say a low socioeconomic background, from the remote part. Girls who have stayed in the metro city, they are quite well versed and they are quite open about it. Since my periods are irregular, but then a girl who has come suddenly into this big city of Pune from a remote place, for her to open up about her periods,
Yeah.
is embarrassing for सामने वाला वो कैसे लेगा, and what is she to tell the सामने वाला about her period. So the regular health checkup should be, because see, the employee is the responsibility of the organization. Unka health, I won't say go wholly into the health. If your employee is a smoker, then you cannot take care of that employee. But then basic health checkup jo hai, either on a yearly basis or say about twice a year at least. Female employees ke liye arrange a lecture with a gynecologist, taking care of their periods. One who will face to face mein bolenge. Sometimes they want to share something but they are scared to share it in front of people. Regular health checkups, blood donation drives वगैरह ऐसे, which will
Blood
help them.
donation does happen.
It happen.
Yes,
It
but
happen.
it
But then
happens
will
on a
make,
very lower
yeah,
note. Yes.
if at all there is something health related, it'll get picked up.
Because as far as I know, as per my experience with the corporate, we have the insurance given,
Yes.
and there are some few checkups which are free,
Yes,
like
you have to get it done once a
yeah,
year,
yeah, and it's very
and
basic.
it involves everything.
Yes.
There are a whole lot of blood tests right from A to Z where nothing is missed out.
Yes.
So many corporate employees, when they come to me that I am in such and such a company or हमारा corporate health checkup था, they come with a such big file which has all the investigations which I have not even heard of.
Yes,
So
and
they get it done, which is a good thing in a
yeah,
way that you are pre diagnosing something where things are likely to go wrong, and then all these reports are seen by some doctor who says that no, it's okay, the reports are fine, so there's no immediate danger to your health, which should be the norm nowadays, especially with this stressful lifestyle in corporate.
But still I have seen that, like you said, that there should be some workshops where
Yes.
the corporate people, it's not only about female, it's about the male as well.
Yes.
They are given a platform where they are discussing with a specialist, in like fertility specialist or the gynecologist like you, and they have a workshop every month or maybe quarterly they can do. But I have never seen corporate doing all these things.
No, they have to get there. See, employees' health is a priority. There with so many pre-existing diseases, you never know कौन अंदर से कितना बीमार है या अच्छा है.
Yes.
And stress related job तो corporate world में बहुत है. So that aspect has to be tackled and taken care of first. कि भाई stress related इस employee में क्या क्या हो सकता है. Because stress leads to alcohol, smoking, where it leads to the other.
Suicide as well is happening.
Yes, is the workplace. मतलब वो environment matters. If it's
Yes.
not a very healthy environment, or somebody may not be very mentally stable, emotionally they may not be very stable.
Yeah, because I have
घर
seen
में
few
कुछ होता है.
people, if they are going through some miscarriages or
Yes.
abortions, they are not able to conceive because of any reason.
Yeah, yeah.
You know,
The first
they get
thing that
into
happens is the
depression.
discrepancy, वो तो compatibility कम हो जाती है. And
Yes.
that IT sector and that IT jobs are unfortunately so demanding. They are just unable to think of anything else. They switch jobs, company either closes down or there is a rapid the termination, and then the next question is where to go and what to do.
Yeah,
So
right.
all one this thing leads to the other.
So, do you think, which I feel that the men out there as well need to open up and talk about these things very openly instead of treating it as a taboo
Yeah,
or
they need to, because these diseases are more male dominated, excepting for infertility and period. Corporates may, there are a lot of male dominated, I won't say diseases, but male dominated health issues as well. 75 to 80% are diabetic only because of stress or smoking or that. So one needs to take care of this, of his health individually, and of course it is a responsibility of the company also कि भाई 2 3 4 महीने में तो एक का किसी का तो उनका चेकअप कराओ.
Does this fertility is related only to women, or it's for the men
No,
as
it's for
well?
the men also. It's for the men also, because the amount
But then why men are not targeted that much?
they are not. That is what I'm saying. They are scared to open up. See, they consider it still as a stigma. Suppose if a male is there, he's about say 100 kgs, working in a corporate hospital, a very heavy smoker, drinker, वगैरह है. He's married since about 4 or 5 years. He's 32 years old. He's unable to conceive. और investigations में ऐसे आया कि infertility के उन्होंने treatment शुरू की. And then the final result is that azoospermia है. There is some problem in his sperm count. Or he's a diabetic, उसके वजह से he's not able to conceive. He smokes so much कि उसकी overall health hamper हो गई है. So that aspect has to be taken care of, which men are थोड़ा
So
hesitant about.
in our society, do you think so that women are only always pointed out?
I told you the finger pointing starts at that time, because
At
women
women
का कैसे,
only.
yeah, women में there are so many factors. The age is there, whether she's fat or she's thin, whether her periods are regular. Male में whether he's a smoker or not, comparatively it is that unfortunately the women is the one who's targeted first.
For always. And nowadays I have heard about the PCODs as well,
Yes.
and they always they end up saying that okay, there's a PCOD with the women, and okay, now that's why they conceive and the other parts are not
No,
happening.
that is another thing, that it's like a bottom line. The PCOD है तो pregnancy नहीं रहेगी. That is, the PCOD is something which should not be there. But then sometimes this PCOD is either genetic or this PCOD is acquired. Majority of the times PCOD is acquired because of lifestyle bolo, ये stress and these things, where the periods are irregular. The lady puts on weight. She resorts to smoking. There's no lifestyle. There's no work timings. खाने पीने का कोई ठिकाना नहीं. She's there. 3 4 of them are staying somewhere. तो the whole lifestyle is derailed. तो उसके वजह से PCOD होती है. And काम का pressure इतना है, so they know that the periods are irregular. She knows that it has to be treated, but then she said that I've got not no time. So
Okay.
many women say that no, I've got PCOD since 2 3 years, बट मैंने कुछ किया नहीं बिकॉज टाइम ही नहीं मिला. आई टुक सम होम्योपैथिक मेडिसिन विच माई फ्रेंड हैड टेकन, so it improved for about 3-4 months or so, and again I'm facing the same problem. Knowing what is happening and treating what is happening, these are two different things. Half the many of them know, but they don't want to get treated.
So do you think that it's a like self measures taken without anybody's
Yes,
recommendation?
so many of them. There's so many.
Okay.
They overhear 2-3 of them. ये इसको बोलता है वो उसको बोलता है, and the message just passes on from one place to the other. They take something.
Yeah.
The most common thing is आजकल वो weight reduction के लिए जो आयुर्वेदिक, there are some preparations which are available. You take two tablets thrice a day
Yes.
for 6 months, and then you lose 20 kilos in 6 months. So this is all hearsay. These are not proper measures. Nobody knows the authenticity. Nobody knows the clarity. And that is why the women's health suffer. They'll end up taking these medicines, and ultimately nothing happens. So the PCOD worsens, fertility is delayed, and the problems double.
Two more questions.
Yeah.
On this scenario. One is, I feel that the HR or the company management, they are, of course, they are giving leaves for the maternity leave, paternity leave, and if they are going through some miscarriages and all, we have leave, because I'm a part of such department, so we have like given leaves and all. So it's just that they are giving leaves, but they are not talking, discussing about it. And once you are back at the work, you are expected to work suddenly in a flow. Like you are on a maternity leave for
Yeah.
6 months or suppose 1 year. Once you're back at work, you are expected to work like a machine, overnight. So don't you think, because of all these scenarios, also people and couples are not opening up about their challenges?
Yes, post maternity leave is always a challenging thing for the woman to get back to as what she was doing when she was not pregnant, because the whole scenario has changed. Many of them don't join, or they just join and they leave. So it is always a challenging part, especially the first month or two after they come back from the maternity leave, to start working as before. नंबर टू, कंपनी का बहुत एक्सपेक्टेशन होता है. आई हैव गिवन हर लीव फॉर 6 months, शी शुड सिट हियर एंड वर्क 10 hours a day.
Yeah, because
नहीं,
that's a paid leave.
that's a paid
Yes.
leave. And because it is a paid leave, there are so many women who say और extension चाहिए. But I don't know whether that further extension is paid or not. I
It
don't
is
know.
not paid.
It is not paid. But then
It is
they are
only extended, it is not
they
paid.
are willing to forego that because paid तो मिल गया है.
Yeah.
And when they know that it is unpaid, वो period कम हो जाएगा.
Yeah.
But they won't take an unpaid leave for 6 months. They'll take an unpaid leave for hardly 15 days.
Yes.
तो वापस आने के बाद में it is a little difficult. It is no doubt to come. And same thing applies for paternity leave also. So half of them, they either leave the company or they become so irregular that they are they are just terminated, or they just join a new company. But then all in all, it's a very difficult thing post childbirth for both of them to come back and start working.
So the organization should give leeway on these scenarios, and
They should, but then
be a
thoda
policy
organization also must have had their policies or whatever their protocol is, that we cannot give a leave for more than this. You had
change.
that is the reason that they, so many of them now keep the child with the parents or the in-laws in their village or native place.
Nowadays in the corporate campuses, we have this
Daycares and- yeah.
and where the company is paying
Yes.
150% or
Yeah,
some margin
yeah,
they are paying.
yeah. But then I feel that such a small child being brought into the daycare where the mother works either full time ho, to it is a great injustice to the child. Till the mother doesn't finish work, the child has to be there.
But
It is good
it's
for the
about
mother, the
father
child also.
responsibility
Yes,
as well, don't you
yes,
think
it is.
so?
It is a shared responsibility.
It's a shared
It's a shared
responsibility, yeah.
responsibility.
But unfortunately, everything comes on the mother.
Yeah, that's what I'm saying. The finger pointing starts at both the end. Everybody points the finger because nobody wants to take the blame on themselves.
Okay.
Everybody points finger. If I say that you're wrong in 2 ways, you'll see to it that you tell me that you're wrong in 3 ways.
Yeah.
So that is what happens.
Yeah. And how about the open discussion on the sanitary napkins and all? Because I still see that even the educated like crowd I have seen, they are not talking very openly about
That
the
is
sanitary
another
napkins.
total different aspect of menstrual hygiene, which has to be maintained. Now, unfortunately, a company will not stress on that because they know, it won't be very well accepted. But then menstrual hygiene is something which should come from within, and it's a very individualized thing. The sanitary napkins or the tampons or the liners which they use, they have to be thrown or in the place which is provided. And the most important thing is the washrooms or the water closets have to be very clean, because majority of the urinary infections in female are because they use a common washroom.
And it's
And
always
so many
a
of-
prolonged one.
Yes, so many of them say by now they have been getting these attacks every 3 months or 6 months. And by the end of the year, when they are so used to taking the antibiotics, they say, "नहीं, हमारे ऑफिस में common toilet है. I know the cause. I know what the infection is, and I've taken this treatment before. So I'll get a urine routine and I'll take the same treatment because I've responded to this in the past. So washrooms have to be clean. Education regarding menstrual hygiene, or what what actually is menstrual hygiene is not only taking a sanitary napkin and bleeding ke baad throwing that sanitary napkin in the dustbin.
There's a way to
There's a way
discard
to
that.
do it. There's a how to discard it, when to discard it. If it's a sanitary napkin or a tampon, you can't and the lady is working for 8 hours, she can't wear the same for 8 hours. So there
Yeah.
are very varieties available now,
And
which
it's not good as well
it's
to
not good as well.
have it for
So
longer
they'll end
time.
up with a lot of skin infections, because all these tampons or all these so-called napkins, they are synthetic material. They say that the material is very soft, the material is very light, but then there are a lot of allergies and a lot of skin infections which come up. So the panty liners have to be changed every time depending on what the particular woman is using. So that some hygienist or some the company may somebody has to take the lead, especially a senior female employee who
Yeah.
has gone through all this, to educate the just the 20s or 30s में जो women है कि what she is supposed to do, because naturally this is a thing which they won't open up in front of everyone.
Yes. Like in corporate, we have departments like transport department,
Yeah,
admin department.
yeah.
So I think there should be.
There
I'm
should
not
be a
saying
health, there
department,
should not be health
healthcare
होना
group
चाहिए,
kind of. Yes.
where 24/7 अगर भी कोई नहीं है, so a visiting healthcare, any person comes there at least, say suppose say once in 15 days. There may
Yeah.
not be, you don't expect a doctor to be seated there 24/7, but then somebody who's visiting,
Yeah.
और
And
अगर कुछ emergency है, so that person is available.
and the monthly workshop should be
Yes.
there, where people can open up
Yeah.
in front of everyone. It's not only about females
No,
sitting inside
no,
and talking. The
no.
men should also know.
Yeah, the men should also know.
know
It's
the
a shared
journey.
responsibility.
Yeah.
And second thing is, अगर कुछ mishap आता है, for example बीच में जो वो like COVID,
Yeah.
or any waterborne infection, these viral infections. So anything which is in the air which is likely to affect everybody, the medical person just sounds the employees कि भाई it's a very bad viral because the temperature drop हो रहा है, lung infection हो रहा है, सर्दी खांसी हो रही है. So just be aware when you come, you cover yourself and come. अगर
Okay.
when to know that you have landed up with an infection, so that they तो खांसते रहते 20 दिन 25 दिन. So they have to be made aware, because a lay person doesn't know what is an allergic cough and what is a normal cough. So some person has to make them aware कि how to take care तो हम लोग बोलते हैं.
Yeah,
But then how to take care,
yeah, what are the
that person has
1,
to
2,
yes.
3, 4 exactly?
When should you suspect that something is going wrong, so that a medical person should at least visiting होना चाहिए, and who comes,
and it should be given on a concession rate as well.
yeah, it should be given on a concession.
Especially the sanitary napkins should be free, I think.
They
as
should
from
be
the-
free as per government of India. It is a
Yes.
free this thing,
Yes.
but then after all the word government comes in. So, yeah.
So it was really great to know all these details, which I'm
Thank you.
sure I was also not knowing much,
Thank you.
and our listeners will, after listening to our podcast, they will understand each and everything which you have explained. So I just want to have a final summary from you about this, all these questions about the show, and what is the message you want to give to all the couples out there in corporate, all the men, women, and what changes they should bring for our future generation.
See, the most important thing is take care of your health, because you are the only one who takes care. All these secondary things will follow. Second thing is, for couples, I would say that early marriage, agar marriage ho gaya and there is a pregnancy, just continue the pregnancy. Don't delay pregnancy due to any cause. Third thing is, work, home, and pregnancy should go hand in hand. There's a lot of stress, but then everything has to be managed, because sometime down the line they have to take a pregnancy ka step. They have to. The fourth thing is, there are going to be challenges, of course. Especially as I said, for working couples, there are challenges where they have to face so many things. They have to at so many levels. They have to fight at every step. हर step पे अकेले कोई झगड़ना पड़ता है. So it's a big task. I do agree. But then time heals. It's a tough time. तो एक हो गया तो then you feel that कि अभी हो जाएगा. Of course, it's difficult. But then there are so many couples who manage it, especially in a metro city like Pune, where it's difficult to get domestic help.
Yes.
So
especially the COVID.
Of course.
Yeah.
And COVID has taught us a very
COVID
good
has
lessons of
changed a
independence.
lot. Yes.
Yeah.
But it has, I think, changed us as well, and to be self-dependent. Don't you
Yes,
think
it has
so?
made us independent. It has made us a lot independent, COVID. And people are scared nowadays. It has वो hitch आ गया है since COVID. Of course, COVID has gone long back. Hopefully, it won't come back. But then that hitch is always there. कुछ भी होगा तो they relate to COVID, either
Okay.
good or bad.
So it was great knowing all these experience of yours, and thank you so much
Thank
for
you.
being a part
My
of
pleasure.
my podcast show.
My pleasure.
And sooner we will have more episodes with you.
Definitely.
And For my listeners out there, thank you so much for listening to my podcast. This podcast will surely change your perspective about the fertility. Please reach out to Dr. Neelkanth Belvi. He is there out there on Practo, and he has clinic in Pune as well, in Pune Vanovari, Nandini Clinic. And his wife is also a gynecologist. So he is a fertility specialist who does not believe in IUI and IVF for now at least. So reach out to him, and till that time, stay tuned for Noble by Richa.